Hi, I'm Terry, and I'm going to do your facial pre-op video today. And each thing I'm going to go over, you're going to have a sheet, a preoperative checklist in your packet that you will either receive here in the office or they will mail it to you in a packet. And as I talk, most everything will be right down the line. And if you understand what I'm saying, they like you to just initial, do not check, but put your initials. If there's anything that you don't understand or you have questions about, just don't put anything there. Call the office, make sure your questions are answered. But I am going to go right down the row. As far as your cover sheet, there will be a form in there that will tell the date of your surgery and the time of arrival here at the office, and your surgery is done here. If you have or have had sleep apnea, you have a CPAP machine, even if you haven't used it in years, they do like you to bring it with you day of surgery, just in case in recovery they may need to use it. Probably won't, but it's just as needed or what if. Allergies, sensitivities. If you are allergic, of course, most people will write that down, but sometimes it's just a sensitivity that people don't think about, maybe a medication that makes you nauseated. That's really important because we don't want that to happen. And anything, whether it's a rash, makes you a little queasy to your stomach, those things need to be made known. So make sure you address that on the chart or you let one of the staff know about that. Blood thinners. Week before, like 7 days, week before, week after surgery, aspirins, ibuprofens, herbal supplements, anything like that, you need to stop. And if there's something else or you have a question about it, be sure and address that with Dr. Eds, especially if you're on blood thinners for heart issues. That's a big deal, so you need to address that. And don't stop anything without Dr. Eds telling you to stop that. Pharmacy, on your chart, you need to make sure you put the pharmacy that you use along with the pharmacy zip code. All of your prescriptions are going to be sent electronically, and that's how they find your pharmacy, is with the zip code, not the phone number. And that you will get prescriptions before surgery, and then with your pain medication that will also be sent day of surgery, digital or electronic. One of the things with pain medication is it can cause constipation. It just kind of slows your system down. So you want to pick up an over-the-counter stool softener. You can do that at Walmart, wherever it is you go. It can be generic, brand, it doesn't matter. But when you start taking the pain medicine, that's when you need to start taking the stool softener, and that can help with some issues. Day before surgery, they do like you to call the office just to confirm your time to be here. If you forget, they're not going to cancel, but it's just mainly touching base. If your surgery happens to be on a Monday, just call the office on Thursday. Hibiclin soap. That's something that you're going to need to pick up. It'll be on a shopping list. That'll be in your packet, and you can pick that up at your pharmacy. If you happen to be at Walmart, I usually see it where the alcohol peroxide is located. It's a little 6-ounce blue-green bottle. It's liquid. And for facial surgery, what do you want you to do the night before surgery, the morning of your surgery? Wash your hair, your face, down to your shoulders, even your neck. It is not a shampoo, but it does suds up. After you've done that, no lotions, no moisturizers, nothing on your skin. 2 things you do not do with the Hibiclins is, of course, you're not going to get it directly in your eye, but you also don't want to pour it directly in the ear canal. But just the sudsing up, rinsing off, you'll be fine with that. As far as your hair, no hair product, no gels, anything like that. It is fine to blow dry your hair, but that's it. Don't do anything else. Do not eat or drink after midnight. Before surgery, and even the morning of, no water, nothing to have. Makeup, none, of course, I've already addressed that. No false eyelashes that morning, no acrylic nails, toenail polish doesn't matter, or no nail polish on your fingernails either. Contacts, none that morning. If you do wear them in, you need to have your case so you can take them out. The best thing to do is, if you need lenses, just wear your glasses. Clothing, something loose and comfortable, but with facial surgery, nothing pullover. It could be zip up or button up. compression hose. This is going to be checked off on your shopping list, and if you will look, the top line, it tells you exactly what you need to order if you go to Amazon. And usually you can get those for about $23, $24 to your house. The compression hose, doesn't matter if they are open toe, closed toe, doesn't matter the color, they just need to be thigh length. And you will see that on your shopping list, checklist. Labs. They will require some blood work, and that just depends on your medical history as far as what they order, but that will be in your packet too. EKG, same thing. It depends on your medical history, but 60 and above, that's just an automatic that you will get an EKG. But it could be younger depending on your health history, and Dr. Eds will go over that with you, as well as the need for a medical clearance. Anesthesia, it is done under general, so you do go to sleep. But that morning, anesthesia will come in, they will talk to you, and I think you'll feel real comfortable with them because they don't just pop in and pop out. They go into great detail, making sure that all your questions are answered as well as theirs. Transportation, you will need someone to drive you home after your surgery, and that person's not required to stay here in the office. They're welcome to, but usually when you get to recovery, your person will get a phone call, text that you are in recovery, and that gives them about an hour's notice to come back. You will also need to be driven back for your 1-day follow-up and your 2-day follow-up, because you will not be driving on those 2 appointments. As far as your diet, it's not restricted. But one thing I think it's a good idea is to have some soft comfort foods available, especially those first couple of days, because the dressing, it is kind of snug. So I think it's just easier to eat the softer foods, but again, there's no restriction on what you eat. Activity, you do need to be up, moving around. That's very important. You're not doing power walks or anything like that, but just up moving around the house. Your weight limit, he says like 10 pounds, but one of the best ways I've always encouraged people is if it makes you strain from the neck up, just back off. And that's for that first 1 to 2 weeks. As far as the position you sleep in or you're sitting around in, just keep your head elevated about 30, 40 degrees. And it's kind of like this. If this is your head, this is your heart, just your head above your heart. And that just helps with the bruising and the swelling. If you drop something on the floor, like my ink pen, instead of bending at the waist, you just squat down to get it, keeping your head above your heart. That can, again, just help with your bruising and your swelling. As far as ice packs, even the night of surgery, through your dressing, it is okay and encouraged to use some ice packs. Ice in a Ziploc bag with a little cloth, you can just hold those up like that, and that coolness will penetrate. When the dressing is off, if you still use the ice packs, you just don't want to put ice directly on your skin. So just make sure there's a cloth over your ice bag. And then your dressing, you're going to look like the dressing's kind of thick, and this is kind of like what you see is like your eye, from your eyes kind of like down around your chin. And the reason is he likes to have a little pressure that first night anyway. So to get that, you can't just put a gauze and a piece of tape, so he does a little wrap. And that's why it looks like you're walking out like you've had head trauma, but actually it's only just to give you a little bit of compression right there. The day after surgery, 24 hours later, he will take that dressing off. And usually he will put a second dressing on, lighter and not as much dressing. And then the next day, that one comes off. And that's when you can go home and get in the shower. You will have 2 drains that come out. They're on like little bulbs. I think they look like grenades. But the staff will show you how to empty it, and your caregiver how to empty that the day of your surgery. And they usually just stay in 1 or 2 days, depending on the amount of drainage that you have. But once your drains come out and you get in the shower, it's a good idea to have maybe Johnson's baby shampoo or a generic baby shampoo. That get in the shower, your hair is going to be matted to your head. There will be some dry blood there. That's just obvious. But when you're in the shower, just take that gentle shampoo, and with the pads of your fingers, you just kind of massage around. You will have some clips right back here. Stitches will be behind the ear, a little bit right here under the chin, and then kind of up, maybe right in here, in that hairline. It's fine for soap and water to get over those, but just with the pads of your fingers, you just massage, and it may take several washings. Once you're finished, just gently towel dry, and you are going to be numb, so it's very important if you're doing it or if you have your caregiver to be combing or brushing your hair. Keep your hand up there where the clips are or the stitches are, and just gently comb. You just don't want to hook one of the clips or hook a stitch. And this gives me pause to tell you too, even when you start blow drying your hair, if you use curling iron or hot rollers, anything like that, months down the road, you still may have some numbness at that point. You want to be very careful that you don't get a burn. So always keep a hand up there just to know how heated that area is getting. Your sutures and your clips, as far as ointment, if you don't have a sensitivity to Bacitracin ophthalmic ointment, over the counter, you can get it at your pharmacies or Walmart. You just put the ointment right where the stitches are. The clips, you do not have to put any ointment there, and it would just get your hair all greasy anyway. And just once or twice a day is all you need to do that. When the stitches are gone, you do not have to use the ointment again. And at your 1 week appointment, most all of the stitches come out, not all, and every other clip. But at 2 weeks, usually everything is removed. So at that point, you don't have to use any more ointment. And when all of the sutures are removed, you still want to give it 48, 72 hours before you start putting makeup on that area where the sutures are removed. Infection, what do you look for? Pus-like drainage, red streaks, temperatures going up, hot to touch, anything like that, you want to let Dr. Eds know. Now, the night of your surgery, if you run a low-grade temperature, that is just dehydration. You just need to increase your fluid intake, so just drink more. Collection. Let's say it's been a week or so after your drains are out, and all of a sudden you notice there's like a little golf ball swelling. Just call the office and just let the staff know about that. It could just be tissue swelling, but it could also be a little collection of serous fluid or a little collection of blood. It's called a hematoma. Neither is an emergency, but they do like to know about that. Would probably have you to come in the office. As far as driving, your paperwork probably says a week, and that's fine if you feel like it, but you just want to make sure that you're able to react quickly. You are going to feel maybe a little stiff, even maybe at 2 weeks. So just be careful and play that by ear. If you feel like it, and if you're if you had to make a quick movement at a stop sign or a stoplight to turn left or right, you just need to make sure you can do that before you drive. Going back to work, that's just something you can address with Dr. Eds. I would say if you have a sit-down job, or a lot of people work remotely now, well, as soon as you feel like it, you're not on the pain medicine. Sensation around the earlobe, he likes me to address this. There will be a little incision right under the earlobe. There's a very superficial nerve that will be cut. And it's rare that I've heard anyone say this happens, but you could have a permanently numb earlobe. So if that's an issue with you, that's something you really need to address with Dr. Eds. Now, in your packet, there is a form, and it says after hours phone numbers. I want to go over those two numbers with you. The top number that you see is the office number here. The second number is the answering service number, where you speak to a person if it's after hours or it's a weekend, holiday, something like that. Cancellation. In the financial policy, right down, about 3/4 way down, it says cancellation. If you cancel your surgery 7 business days or less before your date of surgery, he does retain $500. Well, what if it's an emergency situation, or you wake up the morning of surgery and you have 102 temperature? Go to your phone number sheet. The second number, call that, speak to a person, and you tell them, I am sick, I'm supposed to be there at maybe 7 in the morning, and they said to let them know as soon as possible. They will let Dr. Eds know, and you will not be charged for that, but communication is very important. Same thing for after surgery. What if you need him and it's after hours or the weekend? Call the second number. You just speak to the answering service, a real person. You tell them that you've just had surgery with Dr. Eds and that you need to speak with them. And they're very good about contacting him or ringing through to him, and he'll call you right back. In your packet, there's also going to be some consent forms. They will ask you to sign and date those, and then send that back to the office or drop it off. And again, if you have any questions about any of this, or something that I've said that causes you to have a question, be sure and call the office to have anything that you have addressed. And it has been a pleasure speaking with you. Thank you very much.